For our next special presentation, we have Dr. Edgar Lorma from the University of Illinois, Chicago. He's a professor of clinical medicine and a nephrologist, and he's a longtime patient advocate. Dr. Lerma is working on a project that will help facilitate better communications globally and here in the U.S. around the issue of kidney disease by advancing and fighting for a kidney emoji. Now, this is very interesting to AAKP because we spend so much time and invest so many resources in communications platforms. But the ability to have an emoji with a kidney on it would allow people of many different languages and many different cultures and countries to very quickly communicate about kidney disease and about kidneys. In 2017, the brain was approved as an emoji. In 2019, the heart and the lungs. We think it's long overdue to have a kidney emoji to help facilitate better patient understanding and, most importantly, better activism and advocacy around kidneys, especially on social media. Dr. Lerma will go into this. He'll tell you where we are in the process. And many of you have already written letters and have talked about this on social media, and we appreciate it because we think the decision makers in Silicon Valley who run the foundation that actually approves emojis should be aware of what the patient community interest is in this. We're very honored to have Dr. Lerma, and we look forward to his presentation. Go right ahead, Dr. Lerma.
Pleasant good day to everybody. It is truly an honor and privilege for me to be speaking with you on this AAKP meeting. I've always wanted to be part of this meeting, and it's a dream for me. So with that said, everybody knows it's the 47th Annual National Patient Meeting, Patient Consumers, Leaders for Kidney Research and Innovation. This is me trying to prepare for this slide set, and I hope all of you enjoy this sort of short presentation. As I was trying to figure out which pictures and graphics I'm going to use for this lecture, I came across this nice picture, the lost symbol, the symbol quest. And we will go back to this slide later on. But basically, I've been asked to talk about our movement of trying to create a kidney emoji. That's right, emoji. So everybody is familiar with an emoji. We all see this on our iPhones or in our Android phones, whichever gadget you're using. I want to show you that the way we communicate has evolved so much from the time that the cavemen were writing inscriptions on the stones or carving them on the stones to Gutenberg's first newspaper. And then we went through mass publication, email, and then Twitter, one of the platforms of social media. But if we ask ourselves, when we talked about emoji, the first intended and unintended emoticons actually was shown in the New York Times. It turns out to be the one that paved for the history of emojis. In August 1862, the New York Times printed a copy of the speech transcription by President Abraham Lincoln. And guess what? There is an emoticon on the text. So funny as it seems, it was expected to be a misprint. But in 1881, an American satirical magazine called Puck included real emoticons as part of their typographical art issue, published on the 30th of March of that year. Using typography, it portrayed several emotions, as you can see here: joy, melancholy, indifference, and astonishment. In 1986, Kamoji was considered a thing in Japan. Using the katakana character set, it's a representation of human expressions that particularly focuses on the eyes instead of the mouth. And that's how the 1990s is on a high rise in the use of emoticons, especially for text messaging. However, it is not until 1999 that we understand the first emojis that we know today. So this gentleman, Shigetaka Kurita, a Japanese artist, created the first 176 emoji while he worked for iMode, which is a mobile internet service company in Japan. It all started from Kurita's thoughts. He wanted to design an attractive yet simple way to deliver information. Let's think of it this way. Instead of typing camera, which obviously requires more effort to do so, people can instead use the symbol for camera, and it applies to any other words as well. Starting from that idea, Kurita created a set of 12 by 12 pixel images that work like text appearing on keyboards for iMode users. It consists of several categories of characters, including the weather, the traffic, technology, and the moon. And now you can see Kurita's set of emoji at New York's Museum of Modern Art. So here, this is an example of the wall of the museum where you can see it. Now, after its establishment, emoji became highly popular and commonly used in Japan. Nearly a decade later, some giant tech companies also felt the urge to adopt emoji into their operating systems. In 2007, Google became the first one to incorporate emoji into their email service, which we now call Gmail. Partnered up with KDDI AU, it was a part of their effort to expand their presence in Japan and Asia. So the next year, Google released their own 79 animated emoji for Gmail as well. But this can only be used exclusively for Japan's top 3 telecom carrier users. So at the same year, Apple also launched their own versions of emojis, and this was in November 2008. It was made available on their iOS 2.2 update for SoftBank users in Japan. However, it was also accessible in other countries through other apps in the App Store, which we are now all familiar with. It may have taken years, but with Unicode approving emoji into their Unicode standard in 2010, each emoji finally has its own dedicated block and made accessible worldwide. So, established in 1991, Unicode is the universal standard for digital characters. It assigns a unique code that enables the transmission of any letter, character, or symbol, 10 including emoji, which are iconographic symbols that show information, emotions, and ideas in a pictographic form. So, just a little bit of background. Unicode is an encoding system that represents every language and character in our keyboard. So, the fact that emoji is a part of Unicode is quite a big leap. In 2011, Emoji finally made it into Apple Keyboard on its iOS S update. And then a couple of years later, Android joined the game, making emoji accessible on their keyboard as well. To date, emoji has become as important as keyboard text, be it in text, captions, or even articles. We often slip emoji to add more color into the words we type. Now, due to its immense popularity, Emoji was even adapted into a movie called the Emoji Movie in 2017. At the same year, 2017, Facebook revealed that around 5 billion emoji were sent each day in Messenger. 5 billion. Crazy, right? So you could see here that the emojis are widely used in whatever continent you are in. And you can see this one is in Europe, in Asia, the Middle East, and even in Africa. So, along the development of Apple's iOS, emoji also continues to evolve, as you can see in this slide and the next one. iOS 11, which was released in 2017, also introduced face tracking emoji called Animoji. It enables users to create custom animated emoji using their own face. And by 2020, around 3,000 emojis have been added into the emoji book. And we do believe that it will keep developing along with the other upcoming trends. So, where does this bring us to this conference? We know that kidney disease affects approximately 10% of the population globally. And as of 2019, kidney disease is the 10th most common cause of mortality worldwide, with 1.3 million deaths annually. Acute kidney injury, or AKI, and kidney failure, affect populations with lower socioeconomic status at increased rates. These populations are already at risk for limited healthcare literacy. The recent COVID-19 pandemic has exacerbated risks for vulnerable patients with kidney disease and amplified the need for clear public health messaging. One cornerstone in promoting better kidney health is the implementation of public awareness campaigns that improve communication with patients about preventing disease progression, kidney failure, and associated medical and family burdens. Emoji representation of specific organs can promote better health by improving communication between healthcare providers, patients, and their families. With the explosion of digital and social media sources of free open access medical education, or what is termed FOMED, the importance of visual representations has been reinforced. Social and digital media, where the use of emoji is ubiquitous, represent an important platform for patients and their families to communicate openly or privately about health issues. As far as medical emoji are concerned, there are anatomically accurate emoji only for the brain, the heart, and the lungs at present. A kidney emoji would represent an important addition to existing anatomical organ emoji. The adoption of a kidney emoji would further increase awareness of kidney disease and its outcomes among the new audiences and policymakers worldwide. With the already normalized usage of emoji in digital communication, the kidney emoji can be crucial in helping patients communicate kidney related concerns with providers by the simple act of pointing to or sending the emoji. Furthermore, this enables non medical personnel to discuss the renal system, concepts in health, and primary prevention in a simplified way. National and international organizations, as depicted here, which includes the American Association of Kidney Patients, along with many others, have indicated strong support for the immediate adoption of a kidney emoji by Unicode. This is the letter of support that was written by the American Association of Kidney Patients in our campaign for the kidney emoji. The emoji design is presently being circulated in social media as well as by these organizations I showed earlier through various platforms for feedback and comments. And on acceptance will be widely disseminated using the same platforms, social media, newsletters, websites, annual meetings, etc. International advocacy for a kidney emoji and hopefully its eventual adoption by Unicode in 2023 not only will be impactful for patients with kidney disease and healthcare teams, but will also increase awareness of the importance of kidney health within the general population globally. So again, we submitted our proposal to Unicode in August of 2022. Hopefully, we will hear a positive response by the first quarter of 2023. So what does Unicode look at as far as criteria for approving the emoji? Well, there are three criteria. One is usage. Number two is distinctiveness and recognizability. And lastly, number three is completeness. We know that the kidney emoji represents a complete idea and can act as an adequate standalone representation for wide and frequent use without the need for different versions to represent specific ideas within this category. And again, the goal is hopefully approval by 2023. So we're keeping our fingers crossed. This campaign is really supported by our medical team, as you can see here. So this is the medical emoji team. And I say medical emoji team simply because kidney emoji is only one of the many organ emojis that we have proposed, and we shall see this in the next few slides. But the medical emoji team, our team, is a coalition of physicians, patient advocates, and volunteers who have built the national campaign for a more representative set of medical emoji. So on the lower left-hand corner, you see Shuhan He. In 2019, Dr. He and Jenny Lee teamed up with members of Emoji Nation to submit the anatomical heart and lung emoji. And they are responsible for getting this approved. And this is the anatomically correct heart and lungs that you see now in your phones, in your gadgets. This anatomical heart and anatomical lung were approved as part of Unicode 13.0 in 2020 and then added to Emoji 13 that same year. This is our paper, which we wrote as an editorial for the American Journal of Kidney Diseases. And you will recognize one of the co-authors is Mr. Paul Conway, who is very active with AAKP. In this editorial, we sort of talked about why is there a need for kidney emoji. As I mentioned earlier, we are the medical emoji team, and these are the different organs that we have proposed for approval. So you see the kidney, the stomach, and the intestines, the liver, so on and so forth. We have a website which we use for the campaign called medicalemoji.com. And you could see here that we talked about this, the epidemiology of kidney disease and why it's important. We say that there currently exists an emoji for various beverages, various fluids, which are all ultimately processed by the kidney. And so it is important that we recognize this and hopefully approval in 2023. As I said earlier, one of the important things I want to emphasize, one cornerstone of promoting better kidney health is the implementation of public awareness campaigns that improve clear communication with patients about preventing disease progression, kidney failure, and associated medical and family burdens. Lastly, I'd like to quote my good friend, Dr. Sita Pati, who is part of our medical emoji team. And he did say, the kidney emoji will not only improve communication between patients and their healthcare providers, it will also prove to be a valuable tool for patients in helping educate their family members and the community at large about what the kidneys do and why kidney disease matters. With that, I say thank you very much, everyone, for your attention and have a pleasant day.
Thank you very much, Dr. Lerma, for a great presentation. You can count on this. The American Association of Kidney Patients is working hard alongside with you to get a kidney emoji, and once we get it, we will use it actively, globally and here in the U.S., to help educate patients and further engage patients in the advocacy process. Thank you very much.